I rise in support of protecting patients against PBM Abuses Act. This is a big issue in my district. As we all know, the rising cost of prescription drugs are causing significant financial burdens for millions of American patients and seniors, and as we said earlier, is putting our independent pharmacies out of business. Too often, Americans have to choose between prescriptions and household expenses, which is absolutely unacceptable. This is why I've been actively advocating for reforms in the PBM space, with rebates and administrative fees paid to PBMs being tied to medicines' list price. We're seeing blatant preference of medicines with high list prices and larger rebates on drug formularies for the purpose of maximizing PBM revenue. This is because currently rebates and administrative fees paid to PBMs are tied to a medicine's list price, which only results in higher costs for patients. I want to thank my colleague from Georgia, Mr. Carter, for introducing legislation to address this egregious issue by prohibiting PBMs from earning a profit based off a Medicare Part D drug list price or delinking PBM compensation, and instead limiting PBM compensation to a flat dollar amount service fee. As co-sponsor of H.R. 2880, I encourage my colleagues to vote in favor of this bill and to help restore transparency and patient-centered solutions to our healthcare system to put downward pressure on the cost of pharmaceuticals at the counter. We have more work to do. We've talked about that today, but let's get this done. With that, I yield back.